this?
Oh.
You can just get started.
Okay, I'm going to get started. Turn this on.
No.
Hit the mute button.
Yeah, it looks
Okay.
in green.
I hit select. It's okay. It's working? Yes. Okay, we're working. Okay, thanks. Welcome, everyone. Let me begin. We are privileged to be able to meet on the traditional ancestral and unceded territory of the Squamish people, as always, and we are grateful for that. I'm pleased to introduce this is our, how many Voices in Health?
Ooh,
Several.
sixth.
Sixth Voices in Health. Stay tuned, there will be more. We're planning something very interesting for next month, shifting back to a more global perspective, and looking forward to April, May, and even June, I think.
Yeah.
Okay, so I think we are also live streaming on the web and to our colleagues at UBCO. So, Stefan, you can correct me. I think there are ways to send you questions, or
They can do it through YouTube.
through YouTube. Okay, if you're connected that way. So I'm pleased to introduce our speaker today, Dr. Shannon Waters, who is Coast Salish, and now I'm going to have trouble pronouncing, a member of the Seminis First Nation on Vancouver Island. And we're delighted to have Shannon here with us. She's a graduate of our Public Health and Preventive Medicine Residency Program and an MSc from SPPH. I'm not going to take away from her talk with this long introduction, but it's really great to have to welcome her back to SPPH and to hear about the real work that our colleagues and graduates are doing to have an impact on the health of local communities here in British Columbia. Her topic today, Indigenous Sovereignty is Sustainability. I love that topic, by the way. Thanks. So Shannon. She gets it?
Yeah, she does.
Thanks. Yes, Koya. In the Shannon Waters, Iquanasi Lamnala. It's good to see you. Good day. My name is Shannon Waters, and it's nice to see all of you. I want to start off, as Peter did, by making some acknowledgements, acknowledging the traditional territory of the Musqueam people. I want to acknowledge that I'm speaking to you here today as someone in a whole spectrum of Indigenous health systems that have existed for generations upon generations, and all that I'm able to share with you is building upon everyone who has worked in this area of health and healing before me. And then I just also want to acknowledge all the excitement, enthusiasm, and potential in this room. I was saying to Patty earlier, every time I come back to Vancouver, I used to live here and I went to school here, I feel older because all the buildings here on campus change so rapidly, and so it's always nice to be back in a learning environment and feel the excitement. Peter shared a little bit about who I am. I'm mixed blood. I am Hul'qumi'num on my mother's side. I'm a member of Stamina First Nation, and I have a lot of family ties to Cowichan tribes as well. This is one of the longhouses here in our village with the Cowichan River, the Cowichan Stallout in front of it. Cowichan tribes, some of you may know, you wouldn't necessarily expect that you would, but Cowichan tribes is the largest First Nation community in BC. We have over 200 communities in BC. Some have as few as like less than 10 members. We are over 5,000 members. And part of that is because I always like to reference chiefs from many, many years ago. Part of that was because chiefs in our villages recognized at the time of contact that there was going to be strength in numbers in the times coming ahead. So around this circle here, you can see the names of a number of village sites. And at the time the Indian agents were coming through, the chiefs decided to amalgamate 7 villages into what was called Cowichan tribes to have strength in numbers. And based on the way things have been funded up to this point for First Nations communities, based on the number of people in your community, that was a very good approach. So we're amalgamated today as Cowichan tribes. This longhouse here, which I have connection to, is Khamkhamalats, which is one of the villages. And as you might imagine, when certain issues come up in community, everyone remembers which village they're from. So this is a much older picture of the Khamkhamalats big house. I just want to bring this up because I always like to reference my ancestors. So I started off as a family physician in my home community, and I worked at a walk-in clinic and family practice called the Silver Fern Clinic. And there was even hours in the evening going until 7:30, and one evening I was sitting there and there was no patients, so I was just scrolling the Royal BC Museum archives, which had a number of pictures from the area in which I was living and working. And the vast majority of pictures just said, you know, Indian sitting by a tree, or Indian sitting, you know, by the river. And as I was scrolling through, I came across this picture here. And I had literally the week before met with my grandmother's sisters. My grandmother has passed away at that time. She had 3 sisters and 1 brother still living. I met with my grandma, Amelia, and she was talking about the names of her parents, and it was just, you know, like a lovely conversation. A week later, I'm scrolling through pictures at work, and I come across this picture here of an anthropologist. His name is G.G. Hayde. And in the 1930s, he was traveling through my home territory getting pictures of the area, and he wanted to take a picture in front of the Khamkhamalats big house. But in order to do that, he was told he needed to find the caretaker of that big house, who was my great-great-grandfather, Louis George. And because he had to track down Louis George to take that picture, he knew his name and my great-great-grandmother's name, Jenny, was recorded in the archive. So I was just scrolling through pictures, had just learned my grandparents' names, and suddenly they were looking at me as I was sitting doing family practice, feeling kind of nervous as a new family doctor, and I just suddenly so felt their presence, knowing they were there with me, supporting me, and just struck me how innovative and there for us our ancestors are. I let my grandmother know, you know, over the next few days I brought this picture to her, and she was like, where did you find this? No one in our family even ever had this picture. So they're here with us here in the room right now as well. So Peter mentioned I'm a graduate from here. I have been a family physician, and I have worked at First Nations Inuit Health Branch. I've worked at the First Nations Health Authority. I've worked with the Provincial Health Officer, and now I have the honor, privilege, and challenge of working as a medical health officer. I actually work as a medical health officer in my home territory, so I am the first Indigenous person to have that type of role in the province, and I think across the country actually. And for those who don't know much about what medical health officers do, we cover many areas of public health. So we look at health protection, so the environment, healthy built environment, disease and injury prevention and control. I'm pretty busy because of coronavirus right now. Disaster and emergency management, health promotion, population health assessment, and health and disease surveillance. My boss, who you may have heard of his name before, he's the Chief Medical Health Officer for Island Health. His name is Richard Stanwyck. He's, you know, an amazing man, very smart, and he's a great boss in the terms that he lets us, as his medical health officers, determine what our priorities in our work should be. So for me, in my region, my priorities with regards to my work I do is looking at connection to the land, mental well-being, and maternal, child, and family well-being. And when some people hear this, they're like, wow, that seems like all over the map, like a lot of different areas to cover, and I see it very differently. I see all these things as very interconnected. You cannot get benefit in any of these areas without working on all of them, and any benefit you have in one area is going to benefit all the others. So just want to give you that viewpoint in terms of why I take the time and am so, fueled by talking about what I'm sharing with you today. So, as I said earlier, I'm someone of mixed race, and having worked in First Nations organizations and Western organizations, I'm very aware and constantly looking at how we're faced with, things in our daily work and lives that are coming from differing worldviews. So I'm going to speak here around Indigenous sovereignty and sustainability and climate change and public health, really bringing that perspective of the different worldviews. So there's a worldview that set the foundation for Canada and the social and legal structure we live within. And there's been profound harms to the well-being of Indigenous peoples because of that worldview, and ultimately to all of us. And especially over the last decade to 5 years, there's been growing political and Western scientific recognition of Indigenous worldviews and Indigenous sovereignty. And I see Indigenous sovereignty as fundamental to addressing the greatest threat to our health, which is climate change and biodiversity collapse. So I'm going to approach talking to you about this through 3 different stories. I'm going to be telling the same story 3 different ways. I'm going to start off by telling it from an archetypal landscape. Then I'm going to tell it from a national, international, national landscape. And lastly, I'm going to tell you the story from my view, my local view as an Indigenous woman living in my home territory. So I'll start off with the archetypal version of the story. First, there was a land. And then there were people who came into relationship with the land. And that was sustainable for generations upon generations. At a certain point, there was removal, seizure, and disconnection and theft of people and the land. Over time, that has led to biodiversity collapse and climate change, which is the most significant threat to our health. Through establishing reconnection, relationship, and responsibility as peoples to the land, we can regain that sustainability and work in the areas to improve mental well-being and maternal, child, and family well-being. And these are also the areas of mental well-being where we have the largest burden, hands down, across the board in the province, across the country. The #1 chronic disease burdens are mood and anxiety disorders. And when we look at maternal, child, and family health, which is very much a focus for Indigenous communities, which we don't pay enough focus to in Western systems, what we find is if we put resources into maternal, child, and family health, that is in fact where we get the highest return on our investment. So this is an archetypal view of how all these things are intimately connected. Now I'll tell the story from a international and national landscape. And you'll see here in contrast, I'm going to be showing quite a few written documents on the side. And that's one of the hallmarks of this version of the story, is that written documents hold a lot of power. So this story starts quite a ways back as well, with the Doctrine of Discovery in 1493. And this was a law, an international law, and you can see it in some of its written version there, that established spiritual, political, and legal justification for seizure, sovereign ownership, and colonization of the land. And basically what it stated was that Indigenous peoples, because they were not Christians, were not humans. And therefore, that allowed people to say the land was in fact empty and available for taking. Move forward a couple of hundred years, and there's a number of specific countries who have taken some special interest in this area we now call Canada. And Britain and France were 2 of those countries. And the Royal Proclamation of 1763, which is now more widely known because we had the 250-year anniversary and it's been named in some important bodies of work I'll mention a bit later, is the next written document that I want to highlight here. So this was established in 1763 and was used to establish government administration in territory that France had in fact ceded to Britain. And King George reserved lands to several nations or tribes of Indians that were under his protection as their exclusive hunting grounds. So this created this patriarchal, relationship. It did recognize that there was some relationship between Indigenous peoples and their lands or hunting grounds. But it established this role for the Crown where only agents of the British monarch could directly buy interests of the Indians in their ancestral soil. So this created a special relationship between Indigenous peoples and the Crown. Now that, of course, predated Canada coming into being. So the next document I'm highlighting here is the British North America Act in 1867, which created what we now call Canada. And at this time, the responsibility for Indigenous peoples that the Crown had through the creation of the Royal Proclamation was transferred to what became Canada, including responsibilities for some treaties that were already even being created at the time of the BNA Act. And here I want to share this visual that one of my colleagues, Margot Greenwood at the National Collaborating Center for Indigenous Health, has put together. Some of you may have seen this before. We talk about the social determinants of health within public health, and that's something as a public health physician I work on daily. And Margot had created this visual for the social determinants of Indigenous health, which had some specific things that people are starting to talk more about now in terms of factors that affect our health. And some of these factors go way, way back to, the Doctrine of Discovery and the Royal Proclamation. And so those are kind of around the outer ring of the web here. Land resources. So right off the beginning, it was about land. Connection to the land was disrupted very early. Self-determination and colonization. Now moving forward to my lifetime, there's been a number of significant documents again that have come out that are shaping our conversations here as a country. One is the Royal Commission on Aboriginal Peoples, which was released in 1996. So this is a massive report. I can't even imagine how many hours people spent on it. It's 4,000 pages. I've never met anyone who's read the whole thing. 440 recommendations. And I just want to highlight here a couple that go way back, saying we have to look at the origins of this story, acknowledging that concepts such as terra nullius and the Doctrine of Discovery are factually, legally, and morally wrong and no longer form part of lawmaking or policy development. And they also stated there needed to be some different changes to legislation, including a new Royal Proclamation. So that document, that legislation that created that relationship between the Indigenous peoples and the Crown needed to be renewed. More recently, there's been the Truth and Reconciliation Commission report. So that came out when I was working at the First Nations Health Authority. Another very important body of work that required a lot of effort. Chief Justice Murray Sinclair oversaw this. This report had 94 recommendations. I'll just highlight 4 here, which all included recommending that we repudiate concepts used to justify European sovereignty over Indigenous peoples, lands and peoples, such as the Doctrine of Discovery and terra nullius, and the reformation of laws, governance structures, and policies within their respective institutions that continue to rely on such concepts. Now, Flashing forward to something that's very topical within our BC environment right now, the United Nations Declaration on the Rights of Indigenous Peoples, which came out in 2007, but we did not remove our veto status as Canada until 2016. There's 46 articles within this document, and pertinent to what I'm sharing with you today, I'll just mention 25 and 29. Indigenous peoples have the right to maintain and strengthen their distinctive spiritual relationship with their traditional, owned, or otherwise occupied and used lands. And Indigenous peoples have the right to the conservation and protection of the environment and the productive capacity of their land. When I've presented this before, some people in the crowd, they go, oh, you really comment a lot about what's in the social media. And I mean, especially in public health, we do have quite a role in communications, and using media and seeing what's in media is important. And during last year, I was scrolling through and saw this, UN report says Indigenous sovereignty could save the planet. Of course, that piqued my interest. I took a look and was really interested to see this report, in which we have an author from UBC, can't think of his name right now, I feel really bad, who is one of the authors of this report. Anyway, it was a summary for policymakers of the Global Assessment Report on Biodiversity and Ecosystem Services. And this headline came from the fact that this was an unprecedented report from the UN in terms of the number of documents they looked through, the number of people working on this report, over 150 authors. And basically, the conclusions that they came to, and just highlighted some of the key points I want to bring across here in red, is nature is generally declining less rapidly in Indigenous peoples' lands than in other lands, which is relevant to broader society and can be an effective way to safeguard nature. And that's because, you know what, that makes perfect sense to me as a BC First Nations person, because when you look here in the depiction that the First Nations Health Authority has shared in terms of our perspective on health and wellness, land is part of our wellness. How healthy our land is how healthy we are. So we work to maintain that health of the land in order to maintain our own health. So I'll end off now with a very local story from a Halkamenim woman's perspective, who's working in her home territory, the Halkamenim territory. So this here is a map of our home territory. It was created over time talking to a number of elders, and highlights different places within our territory that had intensive traditional use. This over here, some of you may have heard in the past that Cowichan had camps, ties, and territory over here on the lower mainland. So this is actually Point Roberts here, and that's where Tawasin is, and the Fraser River, and we as Cowichan people had a lot of ties to the Fraser River. So that map was created by what we have in my home territory called the Halkamenim Treaty Group. And that treaty group has been present since 1993 until now. The First Nations communities of Cowichan, Lake Cowichan, Hullal, Layaxon, and Penelakut, and Stamanis are part of that treaty group. And this is one of the reports that had been put out quite early on. It's called Getting to 100%. And it might seem like an interesting title for a treaty group document, but that was really strongly influenced by connecting with elders and community members who said very strongly, the Halkamenim people should benefit from and have a meaningful say on 100% of the territory that belonged to our ancestors. So meaningful say, 100% of the territory. I think very relevant to what's going on north right now. And that, why why it says meaningful say as opposed to ownership of our lands has to do with the complicated and very tragic story of what's happened to our lands since the majority of contact has occurred here within this part of the country. So I have to mention something called the Esquimalt and Nanaimo Railway, or the ENN Railway. When BC joined Canada, there was a promise of, a railroad from sea to sea joining the country of Canada. And BC signed a contract with a very rich individual named Robert Dunsmuir to build a railway on Vancouver Island in return for 800,000 acres and $750,000. And so that 800,000 acres are shown here on this map. There was no communication with any of the First Nations communities in that area. It was just given. And you can see with this overlay of our traditional territory, how much of our traditional territory was basically given away in this land grant in 1884. And since that time, it has passed from one corporate ownership to another over time. To just give an idea for the province as a whole, private lands versus crown lands. So crown lands is where, Britain or now, Canada has the jurisdiction versus private lands. You can get an idea across the province what things look like. And I mean, Eastern Vancouver Island is quite a bit of an outlier in terms of its sharp demarcation and the extent of the area. And basically, with the modern treaty process, the federal government is only talking about crown lands. So in our territory, there's basically no land that's even up for discussion in treaty. So Hulkaminam Treaty Group, with that knowledge, said, okay, well, we're going to create a strategic land plan. And so this here just breaks it down a little bit more. In our traditional territory area, 2% of the territory is what are Indian reserves currently. 14% is crown lands, and 60% is major private land holdings. And so after the land was within the railway, a lot of it went to forest companies. Timber West, Island Timberlands, which have now both joined together to form Mosaic, Hancock Timber Group, and here is listed the North Cowichan Municipal Forest, which I'll mention a bit later as well, but it's an interesting thing to bring up because the municipality of North Cowichan was formed in 1873, one of the oldest municipalities in the province, and they got some of this land that was part of this land grant. And North Cowichan has one of the largest municipal forests in North America. They utilize it to bring in revenue through periodically logging it or what have you. And then another 25% of the territory is another private land holders. So what the treaty group was looking at is that we really wanted to secure co-management agreements with other level of governments to give Hulkaminam decision-making authority over land and resources, or access to resources. So there's this recognition, we don't have any land to talk about treaty over, so we need to talk about how are we going to help have meaningful say and co-manage or co-govern these lands. And sentiments that were brought up within the Hulkaminam Treaty Group work is, we are not of the land, we are the land, like I mentioned in that First Nations perspective on wellness. And Mohstem Osal, our lawmaking authority will empower us to be the architects of a sustainable future for our lands. So our sovereignty is sustainability. They're not different. That's what it is about. A practical example that I am part of that exists and has just actually had its 10th anniversary within Cowichan, Hulkaminam territory is that of the Cowichan Watershed Board. So this is a board that is co-chaired by Cowichan tribes, so that's our chief, Chip Seymour, and the Cowichan Valley Regional District, and has a number of other members, and it was actually brought together in, well, around 10 years ago because of some real dire issues with the Cowichan River. So that's the river in front of that longhouse that I showed you, which we have been connected to for generations upon generations. And salmon go up that river to Lake Cowichan, they spawn. And already, even 15 years ago, in the summer, the river levels were getting so low, the river was hardly flowing, and there wasn't enough water for the salmon to come upstream. Catastrophic, devastating for us as Cowichan people. And there are so many players in terms of how the river is flowing. There's a pulp mill that pulls water from the river. There are farms and individuals that pull water from the river. There's DFO, who's Department of Fisheries and Oceans, who's got interest and stake in how the fish are doing. There's Cowichan tribes. There's the regional district, and one of the women pictured at the Hulkaminam Treaty Group, Lydia Huitsum, who was our chief at Cowichan Tribes at the time, and she has been the chair for a number of years at the First Nations Health Authority as well. She brought people around a table. She's a lawyer by background, and she's like, all these decisions about what's happening with our river are happening outside of our community. This has the most impact to us as Cowichan peoples. We need to sit down and figure out a way where we're working to make decisions together. And so this Watershed Board was formed and is now 10 years in the making, where there's a real, and it's not just, oh, there's a First Nations person who's on the board. It is co-chaired by Cowichan tribes, which is very fundamental in terms of there is meaningful say in terms of how this rolls out. I'll mention, so the Watershed Board has been around for 10 years. It's done a lot of good things. It's been heralded for its approach, but water is connected to everything. There's only so much you can do to protect the water when land, for instance, is owned by private forest companies and we have no say in terms of what happens with logging. And more municipalities, organizations are realizing, what's going on with our climate and declaring climate emergencies. So the municipality of North Cowichan, I live within the municipality of North Cowichan, one of the oldest municipalities in the province, has the largest municipal forest in North America. In July of last year, they declared a climate emergency. So within that climate emergency, they said they were going to look at all applicable decisions through a climate lens. And I'll preface saying, like, a lot of people are like, well, when you declare a climate emergency, what does that mean you do? Well, they said they were going to look at all decisions through a climate lens. Okay. Including but not limited to rewriting our official community plan. So that's looking at the healthy built environment, and I actually am sitting on the advisory group as the local medical health officer for the official community plan and reviewing the management of our municipal forests. So this is our local leadership with North Cowichan, and also just want to mention that North Cowichan isn't the whole Hulkaminam territory, but it is part of the traditional territories of Cowichan, Halalt, Penalachet, and Layaxton First Nation. And also, in and around this time, or just after the declaration of a climate emergency was declared, after 26 years, so let me say, treaty is not a quick process, Hulkaminam's treaty group finally reached stage 5. So we were in stage 4 for over 20 years. That work and those reports that I showed you was part of the work that was done to help create the document that everyone agreed to that went to the government for, rubber stamping. That happened this past summer. And so now we're in stage 5, the goal of developing a final agreement, which we're trying to reach within 4 years. This is our chief negotiator, lawyer Robert Morales, member of our community. And so we have these climate emergencies being declared. At the same time, we've reached this next stage of treaty negotiations. And I see these as very connected. Not everyone else in my community who I work with does, but I'm doing as much as I can to talk about that connection and what it means. And so with the look that the municipal government says they're going to take at the management of municipal forests, what should we do in terms of that? Like, if we have this growing evidence that, Indigenous peoples owning, occupying, or managing their traditional lands safeguards nature, we're in a climate emergency. North Cowichan, albeit it's a very small area of the private forest landholdings within our Indigenous territory, but they said they've declared a climate emergency and they're not going to look at the management of their forests. I think it's time to expand the co-governance model that's been in place and been heralded for the Watershed Board to our management of forests. We should have, a local Cowichan, Halal, Layaxan, or Penelakhet co-chair the Forest Advisory Committee and be there making decisions in terms of what happens in our traditional territory. That is not the case right now. We do have a Forest Management Committee that's chaired by North Cowichan and has some Indigenous members, but really their ability to effectively influence what's going on in terms of forest management remains to be seen, and unless it's co-governance, I think in this time of a climate emergency, it's a moot point. We need to move now, quickly. We've had this model for 10 years in water. We need to move it and expand it to all of our territory. And when I see comments like this, I think it's even more important to move quicker in that direction because we have so much to overcome in taking that approach. So this came out in the Times Colonist in the summer. There's a lot of talk in our community about the trees. And non-Indigenous members of our community are getting concerned about the trees as well. A lot of my home territory was logged. All of it's been logged. There's like tiny patches of old growth. And so the cycle of logging kind of goes on a 40 to 50 year time frame. So a lot of people within their recent memory haven't seen large cut blocks because the large cut blocks are largely out of eyesight. But people have been walking through our community, through some of our municipal forests, and saw a lot of trees tagged, and they're like, what does that mean? It means these trees are going to be cut down, and people were, getting concerned. And so there's been a lot of conversations happening which haven't always placed Indigenous peoples and our inherent rights to land and treaty within the conversation. And this came out in and amongst all that kind of brouhaha kind of in our community. And this was Larry Pinn, who's a veteran environmental journalist, winner of many journalism awards, who's a very recent settler in our territory, moving from Tawasin to Maple Bay in the Cowichan Valley. And the first two sentences in his periodical just, I think, demonstrate how far we have to go. He said, "We live in an era of reconciliation. Everyone wants First Nations to improve their situation, to prosper economically. And what is it going to take to transform these kind of thoughts or words out there to Indigenous peoples can save the planet?" So I just want to end off with some key messages that I hope maybe you guys will remember some bits of this story and maybe things that you can take away that we can all do. Whenever we talk about Indigenous health, or climate change for that matter, I think we have to acknowledge land as the root issue. Since, the Doctrine of Discovery, over 500 years in the making. We need to work to repudiate, that's very strong language from these documents I shared with you, repudiate the laws, governance structures, and policies that continue to rely on the Doctrine of Discovery, which is basically the structure of land ownership and management in this country. I think we have an unprecedented opportunity since in November, our provincial government has brought forward Bill 41. We have the Declaration on the Rights of Indigenous Peoples Act. This is legislated. It needs to happen now. We have this legislative tool to protect our connection to the land and how we manage it sustainably. I hope that maybe you would come away with a key message that you can work to create space or promote models in your own work that reestablish connection, ownership, control, management, or co-governance with Indigenous peoples in the areas that you work within. And I hope we can move beyond the Doctrine of Discovery to something perhaps a doctrine, something such as Indigenous sovereignty is sustainability. So I'll raise my hands. Haid Sapka, thank you, and happy to answer any questions.
Thanks, Shannon. I think you can just, let's open it up for questions and also comments and discussion. Yeah, thank you.
I'll be the book runner.
Okay. Mike.
So I'm still formulating. So thanks a lot, Shannon. Actually, this is I think it's the third presentation I've heard this week with sort of the same theme. So that's
It's mounting.
great to hear. I guess my question is, this seems like a no-brainer, and it's always seemed like a no-brainer to me. But why are we so screwed up? And how do we actually get there? In terms of the baby steps to actually start down this road. Yeah.
Nice simple question.
I appreciate that question because I think what I'm trying to do is two things. So I think we need, and I'm heartened by the fact this is the third conversation or presentation you've been at this week, did you say? Or with these types of topics. This needs to be talked about all the time. It needs to be in our media all the time. It needs to be something our kids know about. It needs to be, and the 500-year history of why this is the case needs to be very well known and talked about. When people are knowledgeable about it, they will be more inclined to think, that it's something that needs to be changed. Then at the same time, there's the very practical things that need to happen. So the Bill 41, implementation, the Declaration of Rights of Indigenous Peoples Act, it's passed. I think there's a whole bunch of people sitting at the ledge that have no flipping idea what to do with this. And it's interesting because in my frustration in the role that I've been in, multiple times, I'll use the example of food sovereignty as an example. I've come across situations where, there's been diesel spills in marine water close to communities, and how can you get the polluter to help, clean things up? And for shellfish or fish that's going to the commercial market, there's, quality parameters. If there's someone who smells diesel, it can't be sold. But for the local people who are eating that as part of their traditional diet, and I was at this meeting where some of my colleagues were sitting around, they're like, well, unless the hydrocarbon level in the fish is at a level that it's a health hazard, and and I think I took a course and did some toxicology with you, Michael, so I appreciate what you've taught me. It's like, unless it's at a level that's at a health hazard, we can't actually use, people are like, well, can we use the Public Health Act to help, you know, put this polluter on the spot? And my colleague looks at me and he's like, kind of like realizes in that moment that the tragedy of our legislation, because he's like, no, unless it's a health hazard, unless it's at that level, it doesn't matter if the quality's ruined and the local community doesn't want to eat it anymore. There's nothing we can do. And like in that moment, I was like, we need to use the UNDRIP to fill this gap. And that was about a year ago, and I've been working with a colleague of mine, Danielle Bain-Smith, at the she's the Aboriginal Physician Advisor at the Provincial Health Officer's Office, and there's a growing number of Indigenous peoples at, you know, these types of positions. And I said, we got to analyze the Public Health Act from an UNDRIP perspective. She's like, yeah, like let's do it. And then we're trying to figure out how to do this, and then she's like, guess what? There's like this bill that's coming forward saying we're legislated to enact UNDRIP. It's like, wow. So then we're like, okay, well, let's look at the Public Health Act. And Bonnie Henry, the Provincial Health Officer, was like, yeah, I want you guys to do this work. So we're feeling really, you know, inspired. And then a little while goes by and Danielle gets in touch with me and she's like, Bonnie's wondering if we would mind focusing on the Drinking Water Protection Act rather than the Public Health Act, because the Auditor General's report just came out on drinking water, and it was scathing to the Ministry of Health and the Provincial Health Officer in terms of what they're not doing to protect drinking water. But at the same time, recognizing that the legislation didn't really empower either the Ministry of Health or the Public Health Officer to really do much for drinking water protection anyway. So Bonnie's like, you know, we have to do this legislative review. There's resources in that area. Maybe you guys could start with the Drinking Water Protection Act. And I was actually, to be honest, really irritated by that. I was like, no, like I want to go big, we got to look at the Public Health Act. But then I thought about it, and I was like, you know, as an Indigenous person, I know water is connected to everything. It's a manageable piece to start off with, which will have ripples in so many areas, like the work I've done with the Watershed Board now needs to ripple into other areas. So we are now looking at how do we incorporate Indigenous perspectives into the Drinking Water Protection Act, because Indigenous perspectives look at water as a living being that we need to be in a respectful relationship with, and we need to ask permission from to utilize it for our own health. Those perspectives now need to be protected within our legislation because of the DRIP Act, which will fundamentally change how we approach drinking water protection. Other regions in the world, New Zealand, Ecuador, Bolivia, have done, a bit of work in this area, so we have some areas to look at to draw, some inspiration and ideas from. But I think that this is a place to start. So we have, the growing, rhetoric of people talking about this being important, and then some of the very practical, quite frankly, pretty grueling, detailed work where we go through legislation to, we're in a climate emergency. We have to review some of this legislation, in my mind, to honor UNDRIP quickly. And so I'll start with the Drinking Water Protection Act, and then we'll go from there. So as much, I guess, support, from other people in terms of these ideas and legislation that are going to be very different from what people have seen before, is going to be needed, because I don't think people in the legislature, I think at first they'll be like, oh great, yeah, start with the Drinking Water Protection Act. Okay, good, yeah, someone's doing something. And then when they see what kind of shifts this is going to need, which will affect the Environmental Management Act, the Water Sustainability Act, the Forest Lands Range Operations Act, they'll all have a ripple effect. So that's the way I'm looking at it, and yeah.
Formulating a question sort of based on the what's going on today out there, because I hear what you're saying, I think, yes, great, fantastic, and you just said it took 20 years to get to work through stage 4 of a treaty negotiation. So what do we hear in the news today? Like, people are going back to Dalgamook and saying, okay, we're told to negotiate, but saying that now they're passing the buck and saying, since 1997, nobody's done that. So when things kind of wall up like they are now, all of this is really great, but it's going to take many years, and so people are out there protesting, blockading, and things are going to happen. Like, how do we make this happen on a quicker timeline, and what can we do as Indigenous people, concerned citizens? Like, should we be out there holding up placards, or should we just take the time and just maybe ask our governments and our businesses to just wait? I mean, can they wait 20 years until we sort it out?
That's a great question, and I think that question, like, we all have gifts as people, and I think you answer that question by like tuning in and like, where do your gifts lie? We need protests, quite frankly. We need advocacy. You know, we need those kids at the legislature right now, and like that's enacting some of your gifts. And then we also need people who are like my gift. I got to go to 13 years of post-secondary. Doesn't feel like a gift sometimes. But like, I'm at this position where, you know, I know the provincial health officer. I have been asked to look at Drinking Water Protection Act. Wow, it's not that emotional. But, you know, that's what I got to do. And, you know, I sometimes feel like, should I be, you know, out there in some of the protests? But I got to support and, you know, give energy to the people that are. And my gift is to work in my area. So I think, you know, everyone has to like look inside themselves, see where their own gifts are, and work from there. And yeah, I mean, our treaty, like 20 years in stage 4, we don't have 20 years. That's where I just really feel hopeful about, you know, hopeful, geez. But I mean, you know, I didn't even know that this implementation of UNDRIPT Act was going to be coming up within BC. It's kind of like, whoa, you know, like sometimes things just happen. It's like, okay, you know, we could have pushed for something like that and it could have taken years. It's here. We've got to run with it. And that's where I just feel like, you know, quite frankly, I feel a responsibility. And Daniel and I have talked about this. Like, okay, someone's mentioned to us to look at the Drinking Water Protection Act. It's not the sexiest act, but let's go. Like, so how quickly can we mobilize some of that work to, you know, get things out there? Because yeah, the tragedy would be is like legislation like this is passed, everyone's lauding the BC provincial government, and 2 years have gone by and no legislation has changed to reflect this. So we got to start somewhere, and yeah, so that's, yeah, and I think that we need all of it, and I think, you know, all of us are going to be needed to figure out what our best way to contribute to that is.
Any questions from online stuff?
Not yet.
Yeah. Oh, Mika?
Thank you very much. Changing topics slightly, as a graduate of this school and university, I'd be interested in your thoughts in terms of our curriculum and addressing some of these the issues that you've raised. I think it's, as you say, it's an opportune time. And so I'd be interested in your thoughts on changes to our curriculum, changes to our program that would help to move both, you know, individual level professionals, but move forward. You should have just stayed there.
I guess just given the frame of what I've just talked about, I still don't have a great knowledge of public health law. I think we need to get more knowledge and more, like, when Danielle and I are thinking of, okay, let's look at the Public Health Act, there's not that many people with a law background and a public health background to help in that area. So I think with what's going on in our current environment, getting more knowledge around that, having more knowledge about, which I think has definitely happened over time, about, you know, the history of why we're at this place, and I think you know, more focus on land. So yeah, public health law, land, and the history, I think, is what we need to do with the curriculum. And I know UBC has been trying to incorporate more Indigenous faculty, and that's not always easy and quick, and I think, you know, more of that needs to happen too.
Or maybe even two. Let's see if I can even frame what I'm thinking about as a question or a comment. So one thought I have is that sustainability is a very positive idea. So there are very few people who would be opposed to sustainability. So I wonder how to frame that conversation more broadly, so that more people feel the benefit, the advantage of moving towards sustainability, right? In contrast to a feeling like somebody might be giving something up for sustainability, which is a more abstract thing. Okay, so that's, anyway, I'll start with that.
That's, yeah, I appreciate that question, and that's where I think some of the looking at the differing worldviews, because I think in a Western worldview, sustainability is a concept. In an Indigenous worldview, sustainability is a way of life. And so that's why I think we need to herald, protect, and move forward that way of life to really help us in this time of an emergency. And I think sustainability is a word that's thrown around a lot right now too, and just like declaring a climate emergency or passing an UNDRIP act or saying, yeah, we're sustainable, people are like, well, what does that mean? And that's why I'm putting out there, that means we should support Indigenous sovereignty, co-management, and changing legislation. So that's what I'm trying to get out there.
Did you have another?
I do have another question or thought, just to kind of, I'm a newcomer to British Columbia, Canada even, and there are times when I, usually when the sun is out a little more, but I walk around and I say, what a fortunate location in many ways in the world, in the sense of having the natural beauty, but also the capacity to still adapt and regenerate and be sustainable, which some places that I work in don't have as much as British Columbia has. So so those are optimistic thoughts for me. So I just thought about, put that to you. There is opportunity. You know, there's terrible history, but there is opportunity as well.
Mm-hmm.
So that's kind of a comment, not really a question, but anyway.
Well, I guess I'll bring that comment into the Western and Indigenous worldviews a bit again, and as a mixed race person, I often do that. And I think, you can't live here and not be touched by the beauty of where we live. And so I think that impels a large segment of the population to protect the place that we live. But we have not very many means when there's so many bigger players in order to do so. But that is, and I mean it's around the world, but I think also that is one way to get into relationship with land, is because you appreciate it for its beauty. From an Indigenous perspective, you appreciate it for its being, because it's part of you and it's because it's why you're here. Both those can get us to a place where we are treating our environment differently. And how do we bring those together and meld them, because we are a multicultural place. I think just in this time of a climate emergency, we need to elevate instead of keep it buried as it has been so long, that Indigenous viewpoint of why we protect nature, because it's part of us, because it is our health. Like, that needs to be elevated now. But I think bringing, and I think, yeah, when you get out, and I mean, there's a growing, literature showing like connection to nature is good for your health. Like all that brings you into connection with the land. And so, that's what we got to be promoting as much as anything else. I've said, I don't think I'm very popular within Island Health saying this, but I talk a lot about the mental health impacts of climate change, because I feel in terms of measuring things, which is what we do as public health physicians, a lot of the health impacts of climate change that we see in other places in the world aren't here yet. We're not having, vast differences in vector-borne diseases yet. We do have some pretty striking stats in terms of forest fires and things like that, but it's mainly, we can't say what's happening with the mental health impacts, and I think that's, one of the major places the impacts are happening right now. We just can't really quantify it because we're not measuring it. But getting out, connecting to the land, being out in nature is shown to be so protective for our mental health. I've actually started saying, at Island Health meetings, like, we need to consider the outdoors as part of our health infrastructure. Like, we're right now applying for money to build a hospital in Cowichan, and everyone's like super excited, and of course it's good, like, yeah, but it's not, like, we need to protect the environment as just important to our health as the hospital. So that's something I'm trying to also get out more in the public.
Any more questions?
Comments, thoughts? Well,
BCO, Stefan?
anything coming in? No?
Okay.
Well, Shannon, I guess I'll stand up. Thank you. Really, please. Inspiring thoughts and positive thoughts. Thank you. Great. We'll keep you all posted on our next Voices in Health event.